My name's Bill Vaughn. I work with the Anderson County Sheriff's Office as a captain of the detention center, currently directing the director of the detention center. What I'd like to discuss today is a new initiative that we're pushing out as a result of several positive things that, as soon as the new administration came in, it began by trying to tackle the overcrowding issue at the detention center. The initiative began back in the spring of 2017, where the National Institute of Corrections was consulted and asked for them to come and kind of evaluate not just our detention facility, but our criminal justice emphasis or structure. That began, like I said, in 2017. In the spring, led over to the summer, and into the fall, where they actually did a town hall meeting. Not only did they address the overcrowding issues at our facility that was built originally in 1956, but they also give us a pathway to look at other things within the criminal justice system. We're fortunate that our county has been very supportive of these initiatives, and actually in August of 2018 signed a resolution for us to go forward to better our criminal justice systems within our county, but also how the detention center functions and the intake of folks that come in our facility. This effort was a partnership between the Sheriff's Office and the county as a whole. And a county resolution was passed in August of 2018. What the initiative is a step-up initiative to better identify, intervene, and treat those individuals who are in our criminal justice system that have serious mental illness. And that's where the Sheriff's Office and the detention center are pushing out an initiative for a mental health screening within, as these individuals come into our booking process, to do a type of mental health screening. These mental health screenings are used nationally and statewide in a lot of different states within the continental United States. We have chosen to go with one that has 8 questions associated with it. The reason why we chose the 8-question mental health screening is because this is going to be taxing on our facility a little bit, to some regards, because it's going to increase our booking process. Currently, we only have really one booking window when an officer from many jurisdictions bring their individuals in that need to be processed. Using that time, we find it very important for 2 different reasons. First, to try to start the process is just the right thing to do with folks that are suffering from some type of mental illness. But the major part of it is officer safety. If we can get some type of documentation or get something started with our great partnership that we have developed with mental health in the Anderson-Oconee area, for those folks to get treatment, and while they're staying there within our facility until their court date or any type of other judicial acts that they need to go through, it's better for our officer and their safety. Currently, we ask questions, but they're more geared toward health concerns. For example, do you have any illnesses? Have you been in the hospital recently? What type of medications you're on? This initiative is actually going a step further to ask them mental health type questions, whether they have issues with things that someone without mental health or mental health issues would not answer in the affirmative. So these questions that's being asked are just an assessment by someone in our detention facility to pass that information along to our mental health supporters and partners. The ultimate goal is to address those mental health issues while they're inside our facility, at least start the process. What the initiative is trying to do is, we've noticed that through our data, in 2017 we had a 28% increase of first-time evaluations. In 2017, the incarcerated persons went up. The population that agreed to treatment while in our facility, those numbers rose by 19%. The local detention center statistics is consistent with the national average as far as individuals in our facility with mental illness that tend to stay longer, which cost on an average 2 to 3 times more for those individuals in our facility. The initiative is not to get these individuals out quicker to save money and resources, but to get those individuals a partnership or get them started with treatment to reduce recidivism and keep these individuals out. That is also a push by the sheriff's office in order to potentially prevent a possible victim later on because of them not having treatment once they are released from our facility. And we're finding that leading up to this initiative that the detention center is starting, is there's been some barriers that we've come across. Well, one is making sure that we're doing a real evaluation of our staff, because we're only using the existing staff that we have. We haven't necessarily added new positions to make sure this initiative is done and done effectively in order to get the documentation needed to get these services to these folks. A responsibility that we have, in our opinion, because it's the right thing to do. Mental illness is an issue that is national and state and local. We've already established relationships with mental health in the community. We also are looking forward to gaining other relationships and partnerships with other entities in our community in order to help these individuals get treatment, and also, which is going to be a benefit to the criminal justice system and also the community.